Good evening, everyone. Yes, today we decided that we'll be discussing muscles of the upper limb, especially the ones which get attachment on the clavicle, scapula, and the humerus. So, in order to cover our preparation for MRCS part A, so let's begin. I'm still continuing with the Netter's Atlas, as you could see, and I'm sure it's visible in front of you. The anterior view of the chest. And the most importantly, I want you to have a look at the bone. It's the acromion, and this is the clavicle. And this joint over here is acromioclavicular joint, right? This is cephalic vein. You could see prominent coming here, and certain muscles. So first of all, if you look at this, I want you to consider that muscles, all of these muscles, they are divided or categorized, one can say, into superficial and the deep, extrinsic. So if there is extrinsic muscles are those muscles which are responsible for the outer movement of the body, right? They are not the intrinsic muscles or the particular muscles which could be found in one particular region. We just say we're discussing upper limb. So those muscles which are only limited to the upper limb are called intrinsic muscles. So this is what, according to Netter's, or according to broad classification, you can say one can categorize these muscles. Right, so moving here. First, I said superficial extrinsic muscle. One of them is trapezius muscle. So this is one. Another is latissimus dorsi, which cannot be seen. It can be seen here. Latissimus dorsi muscle here from the back. It's mostly, if you know, or I'll tell you, it's mostly muscle which is used in climbing, when you're climbing on the mountains, etc. So this is the latissimus dorsi which comes handy, or that's when it's more. Coming back to trapezius, when you lift your head up, then it's the trapezius. Right, then coming back to the deep extrinsic muscles, these are the levator scapulae and the rhomboid, major and minor, which cannot be seen in this image. Obviously, they'll be on the posterior view. Now, coming back to the intrinsic muscles, the most important is the deltoid muscle. So if you tell me the origin and insertion of the deltoid muscle, since we are discussing the upper limb, so I'm only going to focus on the muscles of the upper limb right now, not the extrinsic muscles. So these are the intrinsic, or you could say the actual muscles of the upper limb. So deltoid muscle, it has one it arises from the lateral third of the anterior clavicle. So this is clavicle. And as you could see, this is the lateral 1/3. This is this point, this junction, medial 2/3 of the clavicle. So easy to remember, lateral 1/3 of the anterior surface of the clavicle. And acromion, because as you could see, it's going in front. And the inferior edge of the spine of scapulae. Right? So that's from the back, you'll be able to see. So where does it insert? It inserts basically here, this joint, deltoid tuberosity of the humerus, right? It's innervated by the anterior and the posterior branches of the axillary nerve, or you could say simply by the axillary nerve. What's the action of the deltoid? Very interesting. It's it flexes and medially rotates the arm. It's the acromial part of the deltoid. And the spinal part, it helps in extension and lateral rotation of the arm. So basically, since clavicle is at the front, so it helps in medial rotation and flexion of the arm, not the forearm, arm. And the part which is attached or takes its origin from the acromion and the, as I told you, the inferior edge of the spine of the scapula, that causes lateral rotation and part of extension of the arm. Now moving down to teres major. In this view, I cannot see teres major, but teres major is also one of the muscles of the, wait, we are moving up to, yes, posterior view. Here you could see teres major, it's this muscle at the back, and teres minor, it's this muscle, right? So if we discuss teres major first, so it takes its origin from the posterior surface of the inferior angle of the scapula. Since it's here, you can imagine this is scapula. So it takes its origin from the posterior surface of the inferior angle of the scapula, you could see here. And it's inserted on the medial lip of intertubercular sulcus. We discussed the bones yesterday. That's where it gets inserted, and it gets its innervation from the inferior subscapular nerve. And basically, its function is adduction and medial rotation of the arm. Moving up with the teres minor. Basically, teres minor is here, and most of it is covered by the deltoid muscle. Here you could see deltoid has been removed on this side, whereas here you could see the deltoid, and that kind of covers teres minor muscle. So you could see the teres minor, it takes its origin from the upper 2/3 of the posterior surface of the lateral border of the scapula. This is something that you would have to keep scapula in front of you and then remember, or you could see here, it's the scapula, and you could see that teres minor, and then this teres minor is getting insertion into inferior facet of the greater tubercle of the humerus. So greater tubercle of the humerus, inferior facet. And it's basically supplied by the circumflex scapular, posterior branch of the axillary nerve. So axillary nerve supplies teres minor as well. And it's the lateral rotation of the arm and causes adduction as well. Right. Then there is muscle supraspinatus, which initiates the abduction of the arm, first 15 degree, as you know. I have to look at it for you. This is supraspinatus muscle here. If you know, this is the arch, and this muscle above here is supraspinatus. This whole muscle is infraspinatus, you could see here. Infraspinatus, supraspinatus, talking about supraspinatus muscle. So as you could see, it takes its origin from the supraspinous fossa of the scapula, and this muscle is inserted into the superior facet of the greater tubercle of the humerus. It is supplied by the suprascapular nerve, and it causes the initiation of the abduction. And it acts with the rotator cuff muscle. It's also one of the rotator cuff muscle. Right, now as we identified, infraspinatus muscle, it takes its origin from the infraspinous fossa of the scapula, and it's inserted into the middle facet of greater tubercle of humerus. Next time I'll have empty bones at the level as well, so that I could show you where exactly all the bones are inserting. Then you know it's also supplied by the suprascapular nerve, and its function is lateral rotation of the arm. Right. Now one muscle, subscapularis, is left. In this image, I cannot see subscapularis, so we'll move below. Maybe it's visible in the below image. No. Anyhow, it takes its origin from the subscapular fossa and inserts into the lesser tubercle of humerus supplied by the superior and inferior subscapular nerve. Let's see, no. And its mode of action or its function is medially rotates the arm and adducts. It also helps hold a humeral head in the glenoidal cavity. So that's also one of its functions. Yesterday, I discussed or I asked you to tell me what are the muscles which are grouped among the rotator cuff muscles. So I've already told you, and you can tell me now, they're the four muscles, right? One is supraspinatus, infraspinatus, teres major, and teres minor. All these four muscles, they are grouped as rotator cuff muscle. But what do? They hold the head of the humerus in glenoid cavity, and they blend with the articular capsule in order to reinforce it. So that's also one of the functions that strengthens the shoulder joint. What else does it do? Okay, my battery is almost out. Right. And they arise from the muscular tendinous stuff around the glenohumeral joint. So all these four things form the or contribute to the formation of the rotator cuff, right? So that's what it is for today. What would we do tomorrow? That I want you to revise axilla, and we'll go through axilla tomorrow. And at the end, again, when we'll be revising, then I'll show you the bones. Yesterday, I showed them. 3 lectures actually I've covered with the bones. So today, these are the attachments. You could, in the upper picture, could see these are the rhomboids, minor and the major, and the trapezius muscle here. Whole attachment you could see. If you want, I can tell you as well in a one go that you could see that trapezius. As you could see, it takes its origin from the medial third of the superior nuclear line. External occipital protuberance here. See, medial third, and then external occipital protuberance, ligamentum nuchae, spinal processes of 7 to T7 to T12 here. All this is trapezius muscle. And it gets its insertion into lateral third of the posterior clavicle. You could see here, lateral third of the posterior clavicle. And medial acromion, medial part of the acromion, superior edge of the spine of scapula. It's innervated by the spinal roots of the accessory nerves, right? And its function basically is lost my page. Someone was cursing me, so 337. Okay, let me find it. Got it. Found it. Lost it. 337, 347. Wait. Right. So simple. It elevates scapula, trapezius muscle I'm talking about. It elevates scapula from descending part. It retracts scapula in the transverse part of it. It depresses scapula as like in ascending part, or it rotates scapula as ascending part, acting together. So it's basically elevates, retracts, depresses, and rotates scapula. Other two muscles, not two, three. Latissimus dorsi, levator scapulae, and rhomboid major and minor. Rhomboid major, rhomboid minor, levator scapulae muscle, and latissimus dorsi. This is latissimus dorsi. See this muscle. Good. So for tomorrow, I want to request you to revise axilla, as we'll go through the anatomy of axilla. And once we'll go through axilla, I want you to just focus on the soft tissue. For brachial plexus, we'll have a separate lecture. So yeah. Thank you all. Good night. Bye-bye.